Hey guys, Dr. Brian Opp here from Opp Family Chiropractic right here in St. Francis. And this month we're talking all things men's health. And my topic is going to be on shoulders. Why? Well, I'm getting older and I'm starting to get achiness in my shoulders. I wake up, my hands fall asleep when I'm going to sleep as well. Just in general, working out, often I get sore shoulders. So that's one of the topics because I try to keep my health as good as I possibly can. And shoulders, especially for my profession, is definitely one of the things that I need in order for me to do my job. So I take a special interest in shoulders. Often I'll have patients come in, I'll call them, oh, you have the old man shoulders now. Everybody laughs about it, but I definitely want them to be able to do the things that they want to do in life. So the things that we often see with our shoulder patients is they'll get an impingement syndrome, right? So it's where the tendon gets pinched underneath the collarbone and the shoulder blade area because the thing hasn't been moving. They've been doing things differently, more activity. Maybe they are starting to work out. Overhead stuff really sucks. And so we'll often go through a full exam. We'll look at all sorts of different things. We'll often find that there's some weak muscles, some muscles that are too tight. And we send them home with a couple exercises. And then we often like to do a lot of rehab on those shoulders in order for those patients to feel better. Because sending them home with just an exercise or two, that's just to get them, get the ball moving, getting them feel better, getting them move the shoulder a little bit. But we do need to do a lot of work on those shoulders because often people guys especially, wait till the very last minute until they can't move the thing anymore. And so we're trying to really not have them have to go get a rotator cuff surgery. And when you look at a lot of studies, you definitely don't need to run to the surgeon right away. Often physical therapy, they come into chiropractic. We do some rehab here as well too. So we can do a bunch of different things. We like to do some nutritional things that helps with rebuilding the tissue, taking down the inflammation, changing some lifestyle habits there, especially can be very beneficial to controlling some of the inflammation that's creating a lot of that pain. So one of the big things that happens with the impingement syndrome is the muscle on the outside, your deltoid here, starts to get really tight because it's really trying to do a lot of work because other muscles aren't doing their job. You might have a bicep that might be affected. Muscles on the back side of the shoulder aren't stabilized, especially if you're sleeping on that side. It often starts to raise up. So we'll see a lot of upper trap muscle that's really tight and taking over. And so we start to really give them some things and repattern what a shoulder should really look like and how it should move. So one of the most simple exercises that I give right away is just hooking the chair and you're leaning away so that you can help stretch that deltoid there. If you have a loved one at home, you can have them gently massage it with a massage gun, or they can just gently pound on the muscle, just basically like a little karate chop massage there to help just loosen up the muscle while you stretch it. It's very beneficial. If you're sitting in a job, especially at a desk, doing this throughout the day is very beneficial to get that shoulder loosened up, and almost everybody feels good when they do the stretch. We can incorporate the upper trap when you tip your head away as well, so that's very helpful. We get them adjusted. We work on collarbones. One of the hidden things that often will show up is a jaw issue with the shoulder. It makes sense when you explain it to the patient because if they're clinching, they're stressed, they're gonna start to tighten up all these neck muscles, which is gonna lift the shoulder up and the collarbone especially, and that's gonna start to create a lot of the impingement issues that we have. And so we do a lot of work on the jaw. In my mind, you can't have a neck issue without a shoulder issue. There's muscles that go from one to the other. So getting adjusted in their cervical spine and their upper thoracic. So in between the shoulder blades, a lot of people have issues there as well too. So it's not just addressing just a shoulder issue. We're addressing spinal issues because that's what we do as chiropractic into the shoulder and how everything moves with it. One last thing, one of the major muscles that helps stabilize the shoulder, we'll often work on it along the rib cage here underneath the armpit there. That's a big one that we'll work on. That weakens a lot of different things. And that'll show up as a shoulder blade, just not really doing what it should do. So nutritionally, like we talked about, anti-inflammatories are really important. I take them, especially not around workouts, because you don't ever want to stop your inflammatory process after workouts. But, I take fish oil is always really important. Turmeric, another great one to take on a daily basis. And you're just doing more of like trying to control some of that inflammation that occurs when your daily activities and your workouts, right? So if you guys are dealing with old man shoulders, even if you're younger, it does happen, especially with a lot of people wanting to do pull-ups, overhead presses, things like that. We can definitely keep you in the game and moving great. Thanks, guys.